terms of toxicity, it's reasonably clear that cardiotoxicity can be greater when a regimen contains both an anthracycline and the HER2 targeted agents that all of these patients are receiving. And so, there's an important toxicity difference there. There's also a very slight difference in terms of the rates of secondary leukemias, which are slightly more common with the anthracycline-based regimens. So I think, many data sets show that those toxicity differences are there and are important. And in terms of efficacy long-term and how much the different types of regimens protect against recurrence in HER2 positive breast cancer, I think the data that we have are pretty reassuring that they are equivalent. But that being said, we do completely lack data that were really powered to look at long-term outcomes between an anthracycline and a non-anthracycline chemotherapy backbone. So the data we have are reassuring, but weren't primarily designed to compare the two regimens in terms of long-term outcomes. But I think given the toxicity differences, which are pretty well established, and the reassuring but not totally definitive data that we have about long-term outcomes, that at this point, for the majority of patients, omitting anthracycline in the neoadjuvant and the adjuvant setting is the standard and probably the right thing to do.